Hello and welcome to Ask Dr. Furlong Live, our Facebook segment for this month. I'm Dr. Michael Furlong. I've got a couple of guests here I'll introduce shortly. Today we have a very special guest who is one of our cataract patients in the clinic, and we're going to talk about some of the latest cataract technologies. This is John Unger. Welcome, John.
Thank you.
And then we also have Dr. Mona Sane. She's my associate surgeon here at Furlong Vision Correction. She performed John's cataract surgeries recently, and we're going to get into a little bit of the details of what the plan was and how that helped him achieve his goals. As we go through this segment, we invite you to submit questions. If they come up, we'll try to answer as many of those as we can, and we'll even get to the ones after the broadcast as well and answer those too. So John, welcome to Ask Dr. Furlong. We wanted to bring you in and talk with you a little bit about your story, and we'll get to it specifically in just a little bit. But what I did want to do is talk a little bit about cataract surgery. So as an ophthalmologist, I deal with patients who have, sometimes complex eye issues, and one of the things that we oftentimes will see is patients as they age will develop cloudy lenses within their eyes called cataracts. And then the good news there is that it's a fixable problem with a minor surgical procedure. Dr. Sane has been performing cataract surgery like myself for many years, and as ophthalmology evolves and our technology improves, we get different ways and different technologies to help our patients see their very best. And it used to be that cataract surgery was done only when patients were about to lose their driver's license or couldn't work anymore, and then cataract surgery was scheduled and there was a long recovery, and so we waited as long as possible. But nowadays, with today's newest technologies, we don't need to do it that way. Recovery is very, very quick. We have the advent of new lenses and lasers that can help us achieve goals that patients can not only see their best after their cataract surgery, but historically they still needed to wear glasses following surgery frequently. Nowadays, with the newest technologies, that's becoming a thing of the past, especially with today's technology. So I did want to talk with Dr. Sane briefly, and then we'll get into your story shortly, about two things. One is advanced lenses that are now being used commonly, but also specifically lasers that are used during the cataract operation that weren't around 10 years ago. Can you comment a little bit about both of those?
Absolutely. Thank you for the introduction. And I'm excited to join you and John here for our lively conversation, also with our Facebook friends. Let me start by welcoming John, and thank you for taking the time to come here and join us on this segment of Facebook Live. As most of you know, cataract is a fairly commonly performed procedure. It basically involves replacement of the cloudy lens inside your eye with a clear and a transparent artificial lens implant. Advances in today's technology have provided us with a variety of intraocular lenses to choose from. The basic or the standard lens, also called the monofocal lens, gives you great vision for distance, and it's a great outcome in an experienced surgeon's hands. However, with this lens, the design of the lens requires you to wear reading glasses after the surgery. So if you have to perform activities like looking at your books, reading your iPhone, looking at your tablet, working on your computer, you will need glasses. So you're pretty much dependent on reading glasses for any close-up work. On the other hand, the advanced lenses, also called the multifocal lenses, are a step beyond that. If you wish to have a lifestyle where you can not only see great at distance, but also be able to see very well at near and intermediate distances, then the advanced lenses is the lens of choice. These lenses, based on their design, allow you to focus at far, at intermediate, and also at near, and therefore they expand or increase your range of vision. So you can perform most of your activities pretty independent of these glasses, or pretty, with minimal dependence on these reading glasses. So activities like watching television, golfing, playing tennis, driving, looking at your iPhone, and any close-up work you can do very well without the need for glasses. I'd also like to talk about the option of laser-assisted cataract surgery. There are two basic techniques of performing cataract surgery. One is the traditional or the conventional form, in which the surgeon uses his or her hands to perform different steps of the procedure. The surgeon uses different instruments like blades to get access into the eye, to make an opening in the cataract, and then to break down the cataract into smaller pieces that can be removed safely. In laser-assisted cataract surgery, all these steps are actually being performed by the laser. So that is pretty cool, and it makes the steps very precise, very accurate. The laser machine also has the ability to scan your eyes and look at the different structures in your eyes. It can look at the size of your cornea, it can look at the shape and the thickness of the individual and the relevant structures within the eye. So it takes all these factors into account, and then based on these different parameters, it can customize each step to your eye. It also helps in treating smaller amounts of astigmatism. So laser definitely helps in bringing each step of the cataract surgery as close to perfection as possible. And I enjoy offering these options to our patients and performing these surgeries for our patients.
And just one point on the astigmatism. So as LASIK surgeons, where we're performing these laser procedures on younger patients who don't have cataracts, astigmatism is a common problem that causes blurry vision really at every distance, far, intermediate, and close. And so it used to be that when we did cataract surgery, we ignored that problem. We always said, oh, don't worry, we'll fix that with glasses later. But the whole point of these advanced technology lenses is so you don't have to wear glasses quite so much. So we do need to treat astigmatism very accurately, and we can do it both with lenses, and we can do it with our femto laser, which is the laser Dr. Sane just commented on how it is a newer way to perform cataract surgery. It standardizes the most difficult parts of the surgery, and the precision is unparalleled. So now what I'd like to do is have John tell us a little bit about himself and you know, what you do for a living, and what do you do now, and when you started noticing problems with your vision and got diagnosed with cataracts, what kind of decisions you had to face when planning your surgery.
Right. Well, I've been retired now for 6 years. Unfortunately, my wife is still working, but we have been seeing the same optometrist for the last, 25, maybe 30 years. We have 3 kids. We have been in the same industry, semiconductors. She is still working in technology, and as far as our activities, my activities are more based on things that I can do on my own.
Sure.
Motorcycle riding, of course, is one of them. Tennis, golf, things like that. I do like to be very active. One of the problems that I had, of course, in playing golf was I hit the golf ball and I wouldn't be able to find it.
I'd just like to take a minute here and show our Facebook friends this cool helmet that John has bought here. Tell us a little bit more about this helmet and your hobby, especially motorbiking.
Well, I have some friends that are also retired. We do like to plan outings together, and a typical outing has been taking a trip down south, Southern California, cutting across to Nevada, going to see all the national parks in that area, and then coming up north and coming across. The other types of journeys we like to do is go up the coast up north. There's some beautiful motorcycle trails and roads up there.
Wow.
But those are things that we do maybe annually, just to keep our motorcycles in tune. Other than that, I think that motorcycle riding is just a fun thing to do on a daily basis. Easier to park. You can go the back roads and feel more comfortable doing that.
And what I do tell patients who have active lifestyles and are told to see your best you're going to need cataract surgery, is to strongly consider these advanced technology lenses, the multifocal lens that Dr. Sane referred to, because making that decision is really an important individual one, but you got to make it when you're having your surgery. You can't 5 years after your cataract surgery say, you know what, I've now changed my mind, I'd like to try those new lenses. It's really, you got to be doing it at the time of your cataract surgery. So what, other than having an active lifestyle, what kind of things factored into your decision to choose those lenses?
Well, it was almost made for me. Seeing my optometrist annually, I've been aware for the last 3 years that I've had cataracts that were developing and getting worse. And this past year, he simply told me, after evaluating me, there's no more correction I can do using lenses, and he recommended that I start taking very seriously cataract surgery.
Okay.
And then when I came in here, of course, which is, he recommended Furlong, you guys told me, of course, that I had options that I didn't even realize I had options for. And so that began my education. And of course, I chose the IOCs, and they have been a big improvement to lifestyle.
I'd like to take this opportunity to give a big shout out to your optometrist, Dr. Peter Taylor from Family Eye Care Campbell, for referring John Unger to us. Thank you so much. We really appreciate it. So John, tell me something more about how your experience during surgery was. Was it much easier than you expected? Did you have any discomfort, any pain? How was it?
Well, I mean, before I do anything, I do a little research on it. And on the internet, you hear stories about people saying they were very uncomfortable and it took them a long time to get over it. So I was a little bit nervous about it, but when I came in and talked to you, I felt a little more comfortable about it. Nobody, I think, likes the idea of having their eyes, cut up, but when I actually went through the procedure, it was much easier than I expected. I mean, you're awake for part of it, and then when you inserted the lens, I think I was under.
Right.
I came out of it. The first thing I noticed was how bright everything was. You're getting a lot more light through the eye.
Yeah.
It took me very little time to regain vision, where I felt like I could see fairly well, probably a day. And then I noticed, of course, the colors. I mean, I couldn't distinguish black socks from blue socks, and now I can. That's a big plus to me.
I'm sure your wife is very happy with that.
And so, I did the first one, and really very little discomfort. Almost like, all those other stories, you'd wonder, what kind of procedure they had, because it wasn't like what I felt. And then once I had the second surgery, it was not much different, a little bit different. It felt a little bit different. I think the worst you feel is maybe you have something in your eye, but you're always putting eye drops in your eyes. Of course, there's a protocol to be followed, and that's the one thing that you have to get used to, is that you've got different drops to put in different times of the day. And if you're vigilant on doing that, I think it helps the whole process heal faster. And here I am today with ability to see distance and near. I can read my cell phone just fine without any trouble at all. And my far vision is much improved.
How long ago was your surgery?
Well, it's been about 2 months now.
A couple of months, yes.
Excellent.
Yeah.
I'm glad you had a good experience during surgery. And do you think you were able to go back, resume, and enjoy all those hobbies, all those activities that you were enjoying before surgery?
No, absolutely.
Great.
I
Good to hear that.
I did that to improve those activities.
Good. Well, I'm glad. That's an excellent story. Thank you for sharing it. Maybe we have time for a few questions. Would you guys entertain a few questions?
Of course.
Absolutely.
This is from Tommy. How soon, and you did kind of mention this already, but how soon can I expect to see well after cataract surgery?
Go ahead. In your case.
Well, for me, it was just a couple of days. I will say that the vision continues to improve. You start out with maybe a little light sensitivity, and you're learning to focus differently with the way the dual vision correction is accomplished. And your brain gets better at deciphering sharpness as time goes on. But within a week, I was reading things that I never thought I'd be reading, and of course it improved each week after, and now I think I'm pretty stable.
Great.
Okay, this is from Lauren. It sounds like I could develop cataracts even if I had LASIK vision correction. Is that correct?
Yeah. So cataract surgery and LASIK or laser vision correction surgery are two completely different procedures, and they are done on different parts of the eye. Laser vision correction is done on the cornea. It is a reshaping laser surgery, which is done in patients who generally done in people who do not have cataracts developed yet. And it does not affect the rate of progression of a cataracts. cataracts will eventually develop at some point of time in your life. It's an age-dependent phenomena. It's a time-dependent thing. It's just like having wrinkles in your skin or graying of hair. And generally, the people in the age category of 60s or 70s will develop significant cataracts. And again, to answer the question, LASIK does not affect the natural progression of cataract, and it also does not interfere with the cataract surgery when it's needed at a future point of time.
What other services do you offer, vision correction services do you offer than what you've already spoken about?
Right, so we are anterior segment surgeons, and what that is just a fancy way of saying is we perform procedures to help people see better on the front part of the eye, which is pretty much where all of those procedures are done. LASIK and PRK are the two most common laser vision correction procedures that are done. Cataract surgery is very, very common. Cataract surgery is a very common procedure done in the U.S. Probably the number one procedure being done as our population ages. We just see more cataracts forming, and it's estimated that between 2.5 to 3 million cataract surgeries are done every year in the United States alone. So it's a very, very common procedure. Some of the other procedures, as a cornea specialist, Dr. Sane can comment on, but there are some specific corneal problems that aren't quite as common, but she can also handle those as well. Mm-hmm. Would you care to talk about a few of those?
Sure. In addition to cataract and laser vision correction, being a cornea fellowship trained person, I also offer treatment of corneal diseases, different types of corneal transplants like full thickness corneal transplants, partial thickness corneal transplants, the latest being something called DMEC and DSEC. I also offer pterygium surgeries for patients who need to take care of that problem.
And then one other thing that is worth commenting on here is that sometimes we see patients come in that want to get rid of their glasses or be less dependent, but they're not great LASIK patients because they've got the beginnings of cataracts, but their cataracts aren't bad enough to affect their vision yet, so their medical insurance won't cover part of the surgery because it's not bad enough. So they're kind of caught in this between a rock and a hard place. They want LASIK, can't really get it, or they're not ideal. They don't want to wait for cataract surgery, so we can offer even a third procedure there called refractive lens exchange. And what that procedure is basically like doing cataract surgery, but we're operating on a lens that hasn't gotten cloudy enough to be removed. Based on those parameters, and so we can electively choose to do that to get rid of glasses and contact lenses that way and still implant these multifocal lenses as well. We're out of time on Ask Dr. Furlong Live for this edition here in July. Thank you for watching and attending. If you submit any follow-up questions online, we'll be happy to answer them. Personally, I'd like to thank Dr. Mona Sane for joining me on this segment, and her patient, John Unger. Thank you again for all of your time and spending with us and helping us educate our patients on the benefits of the latest technology, cataract laser surgeries. Thank you very much.
Thank you.